If you catching yourself feeling tired sometimes and you're thinking that you're just getting older, then you can find yourself trying to get an extra cup of coffee or taking more vitamins or doing all the things, right? But it still doesn't work. Maybe it's not something that you think it is. We keep chasing symptoms. And today, I would like for you to think about flipping the conversation into finding the root cause of why is it that we feel tired sometimes. Today, we have Miss Margaret Stach. She is a mother, a wife, and a speech pathologist. She's an entrepreneur, and sometimes I don't know how she can do it all, but we are so lucky to have her here today. Margaret, thank you so much for being here.
Thank you so much for having me, Moza. It's a pleasure.
So I know that you came from Poland, right? 25 years ago, but then you've been, in this business for like 14 years. So tell me, how did it all start?
Yeah, so I came to the United States when I was 16 years old, and I came with a dream of being a journalist. So after I finished high school, I studied print journalism and communication. And when I graduated, I found myself having difficulty finding work. And so I ended up working as a graphic designer at a print shop downtown in the city, Chicago. And I just working there for about a year and a half, figured that like a corporate job was not for me. So I searched for doing something else. And at that time, I already had my first son, and he was about 2 years old. And I talked to my sister. She was going to school to be a physical therapist at that time. And she suggested I look into this speech pathology program. So I did, and then kind of checked that out and decided to go back to school and got my second bachelor's and my master's degree. And here I am 14 years later.
Wow. So there was a lot of work, and you took the courage. I mean, like I haven't really heard much about speech pathology, right? And you are in a very specific field. So tell me, like, what's the difference? I know dentist, I know there's some orthodontist, right? So how about, what's the difference between what you do and other people in the field?
So speech pathology as a field is a pretty broad field of what kind of goes into the scope of a speech pathologist. We can work in early intervention, working with kids that are, birth to 3 years old. We work in schools, we work in a hospital setting, work in nursing home settings. So there's a lot of different things that we could do, not just working on the speech, but also working on language, cognitive, and then also feeding and swallowing disorders fall within the scope of a speech pathologist. So when I graduated, my kind of passion was in the kind of niche of feeding and swallowing. I started my career working in the hospital setting, working with head and neck cancer patients that had difficulty swallowing. Also, people that had strokes or brain injuries that had, speech and swallowing problems post their injuries. So that kind of how I started in that niche, and then I started working with kids, and then working with babies, and that was kind of the progression. But then when I had my own kids and they started having some difficulties that I couldn't kind of pinpoint of what was going on, I discovered myofunctional therapy and the world of tongue ties and lip ties, and that led me to kind of go down this rabbit hole of discovering airway and everything that had to do with sleep and how all that relates to mouth dysfunction. And so now I like to call myself not just a speech pathologist, but also a myofunctional therapist and a feeding specialist. And I work with patients of all ages, including infants all the way through adults.
So what I gather is that you work with the people who have some illness, right? Or people that are just like seems to be normal, but then they feel tired or they have some problems with their, airway, right? So you think about it. So the way that I'm not a specialist like you are, but this is what I'm thinking. We have only one mouth. We have one tongue. So if something is, going on there, not the way it's supposed to be, then it affects us, right? Because this is where we, like, number one, we eat this way, right? Airway is important, and then we communicate, right? So to me, it's a very important area that sometimes we don't pay attention to. Am I correct?
Many times we don't pay attention to.
Mm-hmm.
And when it comes to obvious things, let's say, somebody who has an oral cancer, it's an obvious thing that they aware that there's a problem that needs to be addressed. But otherwise, unless you had an injury, had an accident, have a something that you're aware of, you're not aware of how your mouth functions and how it's supposed to function. So I like to explain it in a way that, let's say you broke your leg in a skiing accident, right?
Mm-hmm.
And now maybe you had to have surgery, or it's now in a cast and you can't use it for 6 weeks,
Mm-hmm.
right? But you're home alone and there's this plate of cookies right there and you really want the cookie, right? You're going to figure out how to get there. So you are going to use compensations. Maybe you're going to use some crutches, maybe you're going to crawl there, right? But you're going to figure out how to do it because you have that innate desire for that cookie. And when you start using those compensations, you have this leg, you can't, put pressure on it for 6 weeks, and you use the crutches, you do other things, right? So now your shoulders are going to hurt. You're going to be using more of your upper body versus your legs. Your leg muscles are going to now going into atrophy versus your upper body is going to be more tight. So those are compensations, right? When it comes to the mouth, what happens is most people that have mouth disorder or myofunctional disorder are born with it, and it starts in infancy, so they don't know any different. When you break a leg, you know what it felt like to have a functional leg. In this case, you don't know what it is like to be otherwise than what you are. Does that make sense?
Yeah,
And
absolutely.
so most people are not even aware that there is an option to function in a different way, because over time we create these compensations because, number one, we want to live, right? So we're going to figure out how to breathe. If we can't breathe through the nose, we're going to compensate and breathe through the mouth. We want to eat because that is another innate desire, right? We have that internal motivation. And if for some reason we can't eat in the correct functional way, we're going to compensate. We're going to figure out how to make it work. And then same for speech and same for sleep and all these other things. Everything that we do as a human is a learned behavior, including breathing.
Amazing. I didn't know that, including breathing. Sometimes we take things for granted, right? So I'm thinking, I don't even think about breathing and I'm breathing in and out.
Right.
But now, that's something that is a learned behavior.
Exactly.
So then, just like how I started the conversation, right? Because you taught me something, in a previous conversation that we had. You said that, okay, well, when your oral structure can affect your quality of life, and most importantly, is the air, is the air that you take in. So just talk a little bit more about that and why that's why people feel tired. I want to make sure that I'm clear.
Exactly.
Yep.
Yeah. So if you think about it, foundation of living is for you to be able to breathe. You can go days without food, you can go days without water, but you can only go minutes without breathing. And so our body is designed in, that way, where we're going to maintain breathing as long as, right, and in whatever way it is possible. And so the problem is that when we have a structural implication as the baby is born, the function is going to develop around it. So we look at it from a point of the structure is going to dictate function, but as the baby and the child grows and develops, the function then is going to dictate the structure, how the structure continues to grow and develop. So then we're looking at high narrow pellets, compressed airway, and all these other structural implications that are going to inhibit our ability to breathe. And especially is important when we breathe during sleep. When we look at breathing, obviously we need to be able to breathe during the day to function, but breathing during sleep is the most important aspect, because sleep is such a kind of area when we don't talk about it, and people's like, oh yeah, we snore, or we only get this much of sleep, or I need to have my coffee in the morning, otherwise I can't function. But that shouldn't be the case. We should be able to go to sleep and get the restorative effects from sleep. And when we can't breathe when we sleep, none of that happens. And so overnight, our body is constantly fighting to keep us alive. And whether it is to through like waking us up, extending the neck, rolling us over, making us go to the bathroom, whatever kind of the case may be with somebody's like sleeping problem or the breathing problem that affects the sleep, your body's going to create that because number one function of your brain is to keep you alive.
Well, I need to look at sleep in a totally different way. I don't know if you guys know anything about this. I didn't. So I didn't know. So we learned something new today, right? So tell me okay, so if I am a person at home and I feel like totally normal, so how would I know what would trigger me to come and see a professional like you?
Mhm. So most of the time, people would come and try to kind of see what the problem is once they start become aware that they have something that is persistent. And a lot of times, women are going to be more open to that, right? Women in general are more in tune with their bodies, so they're going to try to kind of listen to the symptoms and the signs and kind of what the body's telling them. But majority of the times is going to be the fatigue, the running just dependent on coffee and sugar and different, stimulants throughout the day to just stay awake. Other things that I see is TMJ problems, especially kind of.
What is TMJ?
So your temporomandibular joint, which connects the upper jaw to the lower jaw, and it allows you to open and close your mouth.
Okay.
so
Okay.
so that's the joint, like your joint in your elbow or in your knee. So
Yep.
you have it right here by the ear. And so people would start having pain, and especially women are more aware and in tune of that. There's a facial nerve that runs really close to that. So there's some compression on that TMJ joint. Women will tend to have pain and discomfort versus men typically will have some clicking, popping. But men, it's just like whatever, just kind of typical things. So they don't pay attention to it until it becomes a
You
problem.
mean when they do the neck and it pop? Is that what?
And no, when you open and close your mouth,
Oh,
your
okay.
joint will literally pop
Oh,
and
oh
make a
yeah.
sound.
Got you. Okay, I've
Yes.
seen they do that
Yeah, and
sometimes.
some people will actually have a locked jaw. So when they open their mouth and they can't close it back.
Oh, okay.
And that's very, very painful. And you have to pretty much go to the emergency room to have that resolved. But at that point, you know that your joint is under so much stress that, there's either surgery and surgery for me is the very last thing
So
that
what
you
do
want
we
to
do
do.
to prevent that?
It's all muscle function.
Yeah.
So if you can work on how your muscles are functioning, you can stabilize the joint and
Okay.
therefore help reduce the pain, reduce the tension, and all the kind of symptoms and the clicking, the popping, all those things that come with it. But other than that, I also have adult patients that come to see us because they've been in orthodontic treatment as teenagers and they had braces again in their 20s and now they're in their 30s and they're looking into possibly having braces again because their teeth are shifting and they're back to open bite or whatever kind of malocclusion with their dentition. And after having one set of braces, two set of braces, then some people start to kind of think about like, okay, why is this happening? And the problem is that majority of orthodontists practice in a traditional way, what we like to call it, meaning that their primary focus is on straightening your teeth, regardless of what it's going to cost you. Meaning, like if we put braces on your teeth, if that's going to result in your TMJ being more compressed and giving you some issues with that, they don't really care about that. And I don't want to say like everybody's like that, but that's kind of how the orthodontists are trained. Their focus is straight teeth. That's it, right? And so they're not looking at why does somebody have crooked teeth or why does somebody relapse from their treatment. And the truth is that anybody who needs any kind of orthodontic work, if we have crooked teeth, crowded teeth, any malocclusions, is because of their myofunctional disorder. So their muscles of the face, the tongue, the lips, the jaw are not functioning properly, and the person is compensating when they breathe, chew and swallow, and then when they speak, and then over time that creates those problems, such as orthodontic relapse, or when we look at kids that have kind of crowded mouths and crooked teeth, and not enough room for all their adult teeth to come in. It's all because that function wasn't there to support the growth of the jaw so that the jaw can accommodate all of 32 teeth. We're meant to have 32 teeth, not 28 or 26. In my case, I had teeth removed when I was little because, I had all these issues. And so here I am, 40 years later dealing with all that and addressing that problem.
Yeah.
So,
So would you like to share your
yeah.
personal experience
I
with
can.
us?
I can.
Yeah.
Yeah. So growing up, I had all these sinus infections. I remember just almost every month, every few weeks, I had another round of antibiotics because I had another sinus infection. And I remember just being habitual mouth breather and just having dry mouth and snoring at night and having all those things. And so that was kind of my life, just going to these doctors all the time. And I had enlarged tonsils and adenoids, which thankfully my mom did not allow the doctors to remove my tonsils, which was like a blessing that she, didn't let them do that. But it is something that a lot of people will have done because traditionally doctors are not trained to look at anything else, just like take things out. So that was the case. And then later on, I remember I was like first year in high school, I started getting these horrible headaches. I had a migraine every single day. I was dependent on pain medication. I could not function without, Tylenol twice a day, 3 times a day. And that was kind of my life for, the next 3 to 4 years. And then as like a young adult, I don't know, maybe 2021, I started having TMJ issues and my jaw started popping and clicking. I started noticing I had the clenching, the grinding, definitely was snoring and, doing all those things. And so when I started looking into later on, when I was already a speech pathologist and kind of got myself into this rabbit hole of myofunctional therapy with my own kids, I'm like, okay, check mark for me, check mark for me, check mark for me. And like, I have all these issues, right? And so then I started looking at, okay, what is the treatment now for adults? Because I was learning a lot about kids and how we can help kids through orthodontic expansion and, doing that and myofunctional therapy. But the general understanding is that once your face is done growing, which happens for girls around the age of 10 to 12, and then for boys, it's more like 8 to 10, then your face is done growing. Like all the sutures around your face and your cranium are fused. When the face is done growing and all the sutures in your face and your cranium are fused, then traditionally the belief is that you can't do anything about it. So I started looking into adult treatment for myofunctional disorders and structural problems such as high narrow palate, underdeveloped jaws, and all that stuff. And I attend a lot of different conferences and trainings and stuff like that. So the topic of an appliance called MARPI came up, and MARPI stands for Mini Screw Assisted Rapid Paddle Expansion, which is a palatal expander that is implanted on the roof of your mouth with the use of little screws. And it's done, when you're awake. You don't have to be sedated for it, anything like that. Obviously, they give you anesthetics, and it's done in the orthodontist office. So you get that appliance and then you crank it. And then you crank it until the suture on your palate, which is, two bones that are fused together right in the middle, that splits. And so when that splits, you keep cranking it to whatever the orthodontist kind of measured you out to be able to get in relation to where your TMJ is positioned, right? So we don't want to kind of mess up your face. We want to make sure that we look at everything and see what we can do with what you have. So in my case, I started my palate at 26 millimeters, which is an average of a 2-year-old.
Wow. So like
Like that.
this. Okay.
Tiny,
Okay.
tiny. And in the course of my expansion, I gained another 13.5 millimeters.
Wow. So that's like, this. So
Yeah.
then it's more like an adult.
I'm
So,
closer to the average female adult.
so you used to have a baby's mouth.
Exactly.
Oh, wow.
100%.
Yeah.
So, but you have to know that the roof of your mouth is also the floor of your nose.
Mm,
So when we expand the palate, we also expand the nasal cavity. So that allows for that nasal breathing
makes
that
sense.
is not obstructed, that is, there's no resistance to it, right? So your body feels that it can control it and it can benefit from it, and there's no effort to it. A lot of people are mouth breathers because the nose is plugged, uh, congested, there's deviated septum, there's enlarged turbinates, and all these things that prevent you from kind of letting the air through freely, and therefore the body feels in that constant effort. And our human nature is to do the least amount of work, right? So we don't want to do a lot of work. So if nasal breathing feels like a lot of work, we're going to do the mouth breathing instead. Make sense?
Yes, absolutely.
Okay.
So, well, thank you, first of all, for sharing that. So now from your personal experience, how important it is to have this fixed because right now, do you feel any better compared to prior to the treatment?
100%.
Hmm.
So my expansion right now is done, but I do still have the MARPI. It's in there because the space that was created, now we have to give it time. The body will fill it with bone,
Mm,
right? So there's going to be a new bone created to fill in that space. And therefore the MARPI kind of stays in there. And then also it allows to anchor the braces so that all my teeth can be shifted over. There's going to be some kind of cosmetic work after that to fix my dentition and stuff like that. But I really don't care about that. Is the benefits that I get from the expansion. So now I feel that I can breathe through my nose freely. I used to get also, I forgot to mention, I used to get nosebleeds like
mm,
frequently. So I don't get those anymore. I can sleep, 6, 7 hours and I'm full of energy. I'm not dependent on caffeine. I don't feel like I'm going to fall asleep behind the wheel driving. I, have a lot of energy. I work a lot. So I feel like I don't have to be dependent on any like energy drinks or anything like that. Also, another thing that I've noticed when I work out and when I do cardio, breathing is so much easier for me. I don't feel like I have to open my mouth in order to like catch my breath. I can continue to nasal breathe even though when my heart rate goes up and my breathing is increased, like the rate of my breath is increased, I can still maintain nasal breathing.
hmm.
And there's so much more that we could go into when it comes to like benefits of nasal breathing when you're active, when you work out, how that improves your resilience and your athletic performance and like all those things. It all comes down to your ability to benefit from the air that you bring into your body. And the
Yeah.
most benefit from the oxygen that we bring is going to be through nasal breathing.
Hmm.
You don't get the same benefits when that air is brought in through your
Yeah.
mouth.
Yep. So that's the reason why that you're so passionate about, what you do, because you experience it yourself, right? And then your mother and your children. So you went through that. So that's the reason why you would like to help not just adult, but children as well. That's why I love the reason that I enjoy these conversations because, and enjoy us working together because I can see how passionate you are. And now because of your passion and because of your mission of helping other people, therefore you go you have been doing this for 14 years. Most people would be, okay, well, I'm good. I know enough. I have enough experience and I'm just do what I do. You always, go to continuous training and studying, right? So when people come to you, they have the most updated information and technology. You're saying that you're going somewhere, soon.
Yeah, so I have always been into continuing education and figuring out, okay, what else is there? What else am I missing? Especially after I started working with patients and being one on one. I have little Johnny or I have Mary, and okay, she is having this issue. Okay, what else am I missing? How else can I help her? Right. So that was always my thing. But once I got into the myofunctional disorders, there's so many little kind of directions and pathway you can go, like it's all connected. So in order for me to have that holistic comprehensive understanding of how mouth dysfunction affects a person on every level, I have to continue my education because I not only go to conferences that are for speech therapists, by speech therapists, but I go to conferences that are for dentists, orthodontists, body workers, PTs, OTs. I go and study from neurologists, nutritionists, GI doctors, ENTs, you name it, right? So there is a whole world, if you can imagine, of people that are super passionate about what I'm talking about today, and we all come together. For example, in January, we're going to Switzerland. So my team and I are going to a conference. It's called Tongue Time. And people from around the world are going to be there. And the topic obviously is going to be on tongue ties, lip ties, and all of that. But there's going to be also other things that are related, such as airway, sleep, and anything else related to mouth dysfunction. So I'm super, super excited because when we go to these conferences, people that are, looking at these things on a daily basis and doing studies and research and working with patients and compiling all this evidence of how do we help these people. They're going to be there, right? And they're going to bring all the current and updated information of, how do we help this person with this and how do we help this person with that, and how maybe tweaking a protocol was more beneficial in this case. And so it's so super exciting for me to go and learn all these things from people all around the world. And we know that, like, Europe and countries in outside of the United States are a little bit more curious, I would say, right? So they're going to have all this information that, had nobody in the United States have heard about it. So I'm like super excited to go there and bring that back home.
Mhm. So now, like I've seen more children and adults, wearing braces, right? More now than probably 20 years ago. Now, would it be a good idea for them to come to see somebody like you before going to the orthodontist?
Yeah. So for sure. And another thing too is you want to make sure that the orthodontist that you go to see is somebody who looks at airway.
Mm.
And unless you go to somebody who talks about airway and does what's called a CBCT scan or an airway scan that fully evaluates like your whole facial structures and your airway, it's, unless you do that, that the orthodontist is not trained enough to understand why do you need braces and what to do about that. And so it is always a good idea to come and see somebody like me beforehand, so we can, obviously, I'm not going to do an orthodontist work, but I can guide you and explain to you why certain things need to happen. What are the structural things that when you do go to the orthodontist you should be asking about? And people need to understand that you need to go and interview your doctor. You need to go and interview your provider. Ask them the questions because you want to know that they have the education, the training, the expertise that you need. Don't just trust, the very first random person that you walk into their office and think that they're going to solve all your problems, because there's a time and place for everything. And unfortunately, with kind of the outdated curriculum that we have for a lot of medical professions, including dentists and orthodontists. Most orthodontists are not trained in this way. So any orthodontic kind of traditional orthodontic office you walk into, they're not going to look at anything other than how to fix your crooked teeth. And a lot of times their treatment plan includes extractions, which is like the worst thing that you could do. When you remove teeth, that you automatically guarantee yourself a collapsed airway, so you're making your sleep and breathing problem worse at that point. So,
Yep.
yeah.
That's a good point. And I hope that you guys pay attention to that. That is important. I was intrigued by some of the things that you shared with me the other day. You said that when you change structure, you change function. When you change function, you change how you breathe, sleep, focus, heal, and live. I think that is very powerful. So now if people would like to get in touch with you, then how do they do that?
Sure. So my practice is called Advanced Therapy and Wellness Center, and we are located outside of Chicago in town Crest Hill, and our website is mytherapywellness.com. Our phone number is 815-782-4196. People can also find us and follow us on social media pages. We have Facebook, Instagram, and TikTok. We do post a lot of educational information there, so feel free to go and check out our social media pages. And if you have specific questions, feel free to message us through any of the social media outlets, but also you can email me directly at margaret@mytherapywellness.com.
Thank you so much, Margaret. I've learned a lot from you today, and thank you for spending time with us.
Thank you so much for having me.
You're welcome.